All right, we're going to go live in five, four, three, two, one. Welcome, everybody, to another edition of Lupus Talks. I'm your host, Ed Peterson, of course, with Dr. Calvina Williams. And she's going to be sharing a great topic for today for all you listeners who have been have family members or friends or anybody you know, coworkers that's suffering from lupus, and also lupus patients who have lupus. This information is for you. This information is true and blue, and we want to make sure that you get the full story here of what is entailed as we close out this year, 2024, moving into the new year, 2025. So we want to make sure that we continue to share information on a regular, consistent basis, weekly basis, every Tuesday, 2 p.m. Pacific Standard Time. You will hear Dr. Williams sharing um, that Lupus Talks from her organization, Lupus of Nevada. And you can also donate online to her website at lupusofnevada.org. She's also an author of a book, two books actually, going on three books. I take that back. Uh, as she continues to share
And,
insights.
and international, I write for an international magazine, Sarah Christian Magazine, and the magazine is getting ready to come out again.
Okay, great. And so that's another thing that she does as she continues. But I'm gonna let her take over and take the floor. And Dr. Williams, you got the floor.
Thank you. Thank you. I'd like to say thank everyone who's listening. We want to expand this, and we're going to expand it. We're just going to keep giving you stories. First of all, I'd like to thank God for the opportunity of being here, and that we do have a wonderful donor that is providing this information uh, through us from her financial aspect of it. I want to say her, but for the company's financial aspect, I'd like to thank them for what they do for us. So let's proceed. And also, I'd like to thank Ed, because he does a lot, and he was the first male on the Sarah Christian magazine. That's something he needs to talk to Cherie about to see when he can get back on again, so he could have anniversary time or whatever. Just talk about the ills and the issues of his health, and see what goes on. She'd love to hear that. So as we go, we're diving into a resource center of lupus. And that's where I got my information from. And I want you to bear with me on this. I'm going to be reading it from the National Resource Center of Lupus. And we're talking about, let me see, because it's dark in this colored area. We are talking about take steps to help protect your digestive system. That is so important, because I know with my digestive system, especially in the morning, I'm having issues with it. I didn't eat anything, but it just hurts. It hurts. It hurts. Now, what I've come across on the air in cyberspace is that for your digestive system, according to Chinese remedy, holistic, they take their hands like this, and I've done it. I did it yesterday evening, and I did it today, and it's been wonderful, wonderful. So I take my hands and I rub them. I rub them real, 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 real fast and get them warm. And I know most of you do that. Digestive system will feel much better. Just warm them, and then take your hands and do this. Sorry. Take your hands and do that. Hold it tightly like you're holding, just holding them. Then you go back again and you do it again. Do it again. You can count to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then you do it again. And you can do that a couple times a day. I'd say I would do up to 20 within 15-minute span, 20 of them. And then you close your hands. It works well for me. That's the Chinese remedy. I suggest we're not saying it's a proven fact, but I'm telling you what I've done and what it's done for me. The digestive system is very complicated, and anything we eat, anything we do, our digestive system can be jeopardized because of our lupus, because of different things that are in our system that hurts us, certain things we're not supposed to be eating that we eat. So as we go on into the digestive system. I'm going to try to, I think I'm going to read on the other side because it's lighter. We are talking about, let me see if I put these other glasses on. Hold on. Let's see if it's going to have me see right. Yeah, it is. Okay. Uh, Lupus can cause vasculitis. That's inflammation of the blood vessel, vasculitis. And what that means, again, like they said, inflammation of the blood vessel in the intestines, sometimes called I think it's ETRIS, and I'm gonna spell it for you because I might be pronouncing it wrong. ENTERITIS, ETRIS. I'm going to look it up phonetically for myself so I know how to pronounce it right. That may be right or wrong, but you've got the spelling of it. The symptoms include abdominal pain. That's pain in the belly area. And I knew yesterday morning early, I had like a knot in my stomach, and I kept feeling around, my belly button, and it hurt. And so I had to do what I had to do, go to the bathroom, drink that coffee to do what I need to do. And then the pain went away. So that's another thing that I was watching, and I'm going to start watching that. Feeling full or bloated. That's basically what that means. And that's what happened to me. Diarrhea, watery poop, nauseated, vomiting, loss of appetite. And I had a loss of appetite a few days ago. So that's something we all need to be aware of. Again, I can have these articles on our website. I can give them to Ed and he'll put them on the website so you can actually see them. Some people with lupus have other problems with their intestines, irritable bowel syndromes, which is IBS. And symptoms may include abdominal pain, gas, diarrhea,
Turn your mic on. Can't hear you. Can't hear you. Your mic is mute.
Okay, people, he's going to call me back in an hour. I apologize for that. Anytime our doctor's office call, we need to take that call. And again, I apologize. The issue is they don't contact me for 45 to 48 hours later. I'm having an issue with it, a big issue, because there was one time when we had, I call them the doctors that cared. There's a few of them, but I had one for 20 years and then I had another one for 20 years. Both of them, the female and the male. That was my primary doctor, and then I had my rheumatologist. Well, since all has gone from that era, from last year, I called up because on my medical, I get acupuncture. I asked for acupuncture because I was having so much pain everywhere in my body. And that's that inflammation, so much pain, trying to figure out what was going on. And I knew what was going on because they took me off of Plaquenil. They just take it off. Plaquenil is a drug that helps you with your inflammation all over your body. So I got a major takeoff. And then I may have mentioned the last broadcast that they took me off for 7 days off of prednisone. I told them, you can't cold turkey me off of prednisone for 7 days. Do you know what that's doing to my inside? Yes, it helps me with my inflammation. It does all of that. And a lot of us are on prednisone. Yes, I've been on prednisone for 18, 17 years or whatever, but you just don't do that. So I explained it to my not primary care, to the nurse practitioner, because the primary care wants to handle all his patients individually without any nurse's help, which I think is going to be it's going to be a sight to see. Okay, I don't get into my primary, for those of you that would like to know, 9 months. Anytime you have an incurable disease, you don't wait 9 months. Anything can happen. Anything can happen to you and the disease. And so when I got with my two doctors, they would call me at home on a Saturday. They would call me on would call me on a Saturday too. They both would call, and I would say, that's Dr. Nita Soni was my primary, and then my other rheumatologist was Dr. Neil Bronstein. Now what was it, Optimin? Yeah, we were under Optimin, and we were under Southwest Medical. When those doctors started shifting, and I mean shifting like what, out in another universe, we had issues. We knew, it took me back for a long time, and I was hurt, I was scared, and to have me really fearful of something here on earth, I was concerned about my body. Who was going to take care of me? Where was I going? What if something happens to me? Dr. Soni would always take my blood tests, and then she would get back with me if something looked peculiar. And then she would call the rheumatologist, and they would talk it over. They'd figure out what's going on here. They would work as a collaboration. I don't know what's going on now. I'm going to tell you that now. I have no idea what's going on in Southwest now. I know I'm under Humana, and I don't think Humana knows what these physicians are doing to us. And I'm going to say it. I'm going to be bold to say it. I'm not going to hide anything, because it's my body, my mind, my soul, my spirit, you know, and I have a hard time dealing with that. And I'm still, you can hear me speaking about it. I have a hard time because we developed a relationship with one another. So that's where we are now. That's my 48 to 50, 48 hours later or 50 hours later, because I asked for acupuncture because I have that under Humana. Now, Humana is good. I like Humana. I like Optimin as well. But I don't know what's happening with the doctors inside and what they're doing and what they want to do. Anytime you've got a doctor saying, I want to do hands-on myself, and then how you going to do hands-on? I know how you're going to do it. Keep me 9 months waiting for you. That's how you're going to do it. So that's where we are now. It's best to be truthful with your own health. I'm not fearing anybody but God, because that's who's bringing me through now. So as we go to the irritable bowel syndrome, I continue on the IBS. The symptoms include abdominal pain, gas, diarrhea, and constipation, having trouble pooping. And that is so true. We have trouble pooping. And I'm going to say blank like that, you know. So that's why the coffee is good, the tea is good, that I drink. That's what I drink to try to do what I need to do. So those are the things, if you're having issues about that, I suggest when we send this article that you read it and get to know your body. Lupus can also cause pancreatitis, or inflammation of the pancreas. Some lupus meds can also cause, pancreatitis. Symptoms include pain in your abdominal belly area and can spread to your back, nausea, vomiting, and fever. Now, I'm having problems in my back now, but I'm dealing with it. I'm dealing with it, but I also know I was reading about the holistic aspect with, Chinese medicine. And what they are doing, and I've been reading this again, I'm going to tell you, and I took the inside of, where you're behind your little, it's on your foot, and it's over there by your heel of your foot, but it's in the middle. It's right there in the soft tissue area. And what I do is take my two fingers and rub them up and down, up and down, up and down, up and down. I do it that way. And I do that a couple of times and then I stop. And then I do it again, up and down, up and down, up and down. And that helps, as they say, with their, that's helping with your, what is it, your kidneys and some other things. And you can read that too. I'm not saying that that's something you should do, because I can't say that, and I'm not going to say that. I'm just saying this is what they were saying to do on, I was on their medical, I think it was their medical area, where the Chinese, and they have their area where they show you what to do. So they have Chinese practitioners. That's what I'm trying to say. So I got up under there looking for Chinese practitioners, and what was going on. Again, the movement of being up and down, up and down. Put pressure on it, and you put it on the inside of your area next to your heel, and then you do the other side. I'm not saying it's going to help you, but I'm saying for me, it helped me. Okay, there's no conclusions if it's good or bad or whatever. Get on the site where it has Chinese practitioners for these types of things that I've been telling you. Again, I would like to put a disclaimer. Lupus is not saying do this. Lupus is giving you the educational information that I am finding is helping me. I don't know if it'll help you, but let's stay in check with one another. We got to do something, because we're not being seen for 9 months. We got some issues going on. So then we have, there's some other areas, but find the right treatment plan. That's all I'm telling you guys. Find the right treatment plan, because lupus can cause a lot of different digestive problems that different medicines can treat them. Now, different medicines can treat them, but when? We don't know. A special doctor called gastrologist, and he can work with you. Rheumatologist is to find a plan that works with you. They can, when you catch them, if they don't schedule you for 9 months. Okay, I'm gonna say that. If you have symptoms of digestive problems, tell your doctors right away. It's important to treat these problems early before they cause serious damage to your digestive organs. And again, I'm saying, for me, I'm trying to catch them if I can. So this is a cat and mouse game, okay? I call. Don't think I just sit back and, I don't know what this and that. No, I'm not gonna play a pity party. I'm gonna call. Then I get 48 to 50 hours later. The first thing they'll say is, go to emergency. Well, everybody in emergency don't know what they're dealing with when you're dealing with a specialty. I'm gonna tell you that. They gotta call a specialist to come in to deal with you. And I'm hoping that's what they do. But there's certain times that specialists will come in and say something, you know more about lupus than I do. I don't know what to tell you. Go to your primary doctor. I said, I can't get in. I don't see him till January. Well, call him up and tell him what's going on, and I'm gonna write this up as well. Go to your rheumatologist. Can you get into him? Yeah, 9 months from now. That really makes them look bad. It really does. So those are the things that personally I'm going through, and I think it's just totally wrong. And again, that's just my personal situation going on. I stopped because it's very upsetting. Now, the digestive system includes the mouth, esophagus, stomach, intestines, and anus, as well as the liver, pancreas, and gallbladder. but digestive problems are caused by lupus itself. Some are side effects of lupus treatments and have other causes like infection. It's a good idea to talk to your doctor if you have digestive problems to find out if they are related to lupus. Lupus in the mouth. Many people with lupus have ulcers. I've had that and still have that. Had it last week. Those are sores inside your mouth. When I was growing up, I would tell my Mom, I got bumps inside my mouth. And she would always tell me, oh, girl, those are live bumps. How many lies did you tell me? And I started laughing. It was funny to me. I didn't know. I may have had lupus back then. I had no idea. But what I did was not right because I started popping them. I started putting my teeth to the bump and just trying to pop them, just, thinking they'll pop. Some did and flatten out, but it hurt to try to do it. So when we look at lupus and we talked about the esophagus, lupus in the mouth. We just got to talking about that. Now we have lupus in the esophagus. Lupus can cause inflammation in the esophagus and weaken the muscles you use to swallow. About 2 years ago, I went into, my doctor then sent me into a specialist, and they looked at my esophagus because it was hard for me to swallow. They did all types of tests, and the next thing I knew, I had to go in and get a procedure. And the procedure was to widen up my esophagus because my swallowing, it stopped right there. It stopped, and then it stopped down here. I couldn't swallow. I was being choked. And so they had to open up. They said it pretty much was common with a lot of people where you have to open up the esophagus because your esophagus is like too small. I'll do it like this, too small. So I make sure I cut my food up in little pieces, especially if you're eating chicken breast. That is hard to get down the esophagus. So what you have to do is cut it real small, and then you can eat it. That's what you have to do. So when stomach acid moves backwards from the stomach to the esophagus, and that's because I take esophagus pills right now. I take that. It's like reflex. And I have reflex. They added the problems like acid reflux, and I do have acid reflux. I take about 2 or 3 of those pills for acid reflux. Now, when the stomach acid moves backwards from the stomach to the esophagus, there are many times I've had to puke up. And my food, and I could feel it, and I could smell it when I ran to the bathroom to do what I needed to do. Then it talks about reflex action that lasts for a long time. It's called gastroreflex disease, called GERD, GERD. Symptoms of acid reflux and GERD includes vomiting, gas, vomiting, throwing up, heartburn, and trouble swallowing. I take all 3 of it. I just want to make sure I'm okay there. Yeah, I take all 3 of it. Lupus in the stomach. Many people with lupus have peptic ulcers. Count me in on that one.
Right.
And that's open sores in the stomach lining, which includes stomach pain, nausea, feeling that you're going to throw up, vomiting. Peptic ulcers are often side effects of medicines used to treat lupus, like non-steroidal or anti-inflammatory drugs like NSAIDs, steroids, and we all know about that. And I done made an A on that because I get all of it. And then we have lupus and the intestines. And lupus can cause vasculitis. That's what that is. Inflammation of the blood vessels in the intestines, sometimes called lupus enteritis. E-N-T-E-R, I think I said it earlier, E-N-T-E-R-I-T-I-S. Again, promise to pronounce it right when I come back on. Abdominal pain, feeling full, bloated, diarrhea, which is the watery poop, excuse me, you guys, for that. Um, Nausea and vomiting and loss of appetite. Some people with lupus have other problems with their intestines, like irritable bowel syndrome. Syndromes may include abdominal pain, gas, diarrhea, constipation, having trouble pooping. And those areas which I had just went over are just so very important. And we think about that. We say, oh my goodness, what am I going to do? Who's going to help me? How do I deal with this situation? Um, there's another one that I want to get into, which is called drug-induced um, lupus. And that's personal for me. Someone, proper English, gave me, dealing with my lupus. I can't pinpoint who, what, when, but drug-induced lupus erythematosus is DILE. DILE is a variant of lupus erythematosus that can cause within days, 2 months after withdrawal of the culprit drug in a patient with no underlying immune system dysfunction. I had no underlying. DILE can arise months to years after exposure to drugs prescribed to treat various medical conditions, antibiotics, those types. The most common drugs that cause DILE are ones that we need to, and I'm going to post that because you need to know about that. That will be posted as well. Drug-induced acute cutaneous lupus erythematosus, DISCLE, is a dial variant with prominent skin involvement, temporarily related to drug exposure and resolving after drug discontinuation. It has been seen as associated with hydrocortisone. Care must be taken to correctly diagnose the symptoms, DILE, and differentiate it from systemic lupus erythematosus. And DILE should be recognized clinically to prompt intervention. Now, I was just taken off hydrocortisone. I think it was hydrocodone, but I'm gonna check that out for myself too, because I pulled this up. So let me do that so I will not forget that, because it's so important to me, because I had been on that for forever. And who knows, maybe they did that to find out what is the culprit. And maybe they did it. Care must be taken. Who knows? The doctor that I have now, maybe he did it. Maybe he did me a favor. But tell me, don't just sit up there and take me off something and say, well, somebody gave you a drug-induced lupus erythematosus. Somebody gave you a drug-induced drug, and we're trying to get to the bottom of it. They didn't tell me nothing. They just told me, oh, you got this drug-induced drug that, you've been taking. Well, tell me something. Don't let me sit up here and look stupid. So that's why we call Lupus in Nevada educational awareness and advocacy. We look things up. Don't play us like we're little babies and we don't know how to deal with our symptoms and our underlying problems. Now, care must be taken to correctly diagnose the symptoms of DILE, DILE, variant with predominant skin involvement, temporary relating to drug exposure and resolving after drug discontinuation. It has been seen in association with, like I said, hydrocortisone and care must be taken to correctly diagnose the symptoms of DILE and differentiate it from systemic lupus erythematosus, SLE. It says, although both SLE and DILE are autoimmune disorders and can have similar clinical laboratory features such as you see in the table below. And I'm gonna go over that, but I'm still gonna have this on our site. It's very important that you know this because I'm learning too. As I read this, to me, this is something, you know. From what they're saying, they're both autoimmune disorders. Did I know that? No, I didn't know that. No, nobody told me that. Let me mark that too, you know. And I would think a medical professional, be it his nurse practitioner, male or female, to call me and tell me what this is. Instead, I'm researching, which is probably a good thing. I'm researching on my own to find out that both of them are autoimmune disorders. They're autoimmune disorders. Tell me, autoimmune disorders, and can have similar clinical and laboratory features. Research suggests different mechanisms, pathways, and pathology, pathophysiology guidelines for diagnosis and management of SLE have been established. Although the pathogens of DILE is not completely understood, a genetic predisposition may play a role. I'm going to check that off. Believe me, after I get off of this site, I'm going to research. As this has been shown with certain drugs metabolizing by these other drugs that are in their system. Now, the comparison of finding between drug-induced lupus erythematosus and systematic lupus erythematosus is a table window. And they got this table window that I'm looking at. It's like right here. You'll see it. It's right there. Okay. And we'll have this on our site. Drugs that cause flares of SLE are follows. And they have a whole bunch of them. Omeprazole, I'm taking that. Oh, let me check that out. I'm allergic to penicillin. Let me check the hydrocortisone. I think I'm taking that. I said earlier, I've got to check that out. Epidemiology, as many as 10% of approximately 500,000 cases of lupus erythematosus in the United States may be DILE. Maybe. That's a big word. You need to look at that. Maybe. Let me circle that one so I can do the research. So next time I can come back next week and have some type of information. Let me put this down there. Information for my audience. Information for my audience. Now, I don't want to say, oh, they're wrong in this. You know, doctors fail too. The medical industry failed too. It's really a game. If you look at it, I'm looking in my mind as a game. You know, it's like, I'm going to give them this. I don't know how it's going to work, but the book said it's supposed to help the lupus. Well, long time ago, they were testing lupus and everything else on mice. They don't do it anymore from what I understand. But I think they were made to stop doing it on mice. But it's just something else. Patients with DILE tend to be older. Oh my goodness, here I am. 50 to 70 years old. 50, that's a wide span for me. I'm 68 now. I just had a birthday in October. Okay, circle that, check that off. And those with SLE average age 29 years, died 29 years at diagnosis. Nope, I was 40 at diagnosis. Let me, what did I do that? Okay, at diagnosis. Let me write, I'm writing this down, y'all, because I need to find out what's going on. Okay? Elderly persons generally are more susceptible to DILE. Deal, I think it might be deal, but we'll find out the pronunciation as well. So, deal, DILE, not dial, the dial is DIAL or DIEL. But this, well, anyway, there's no significant statistical difference. Front, right door. That's what they're doing. And I told quite a few of them that way. You don't care about me telling me, hi, how are you doing? What are you doing today? You don't care. That's just an open statement. So you got to be bold like that with them, and then they won't pass you on. I'm not going to tell you to come to my house. I'm coming to your house on the 22nd. No, you're not. You weren't even invited. You have to do that. You have to let them know. They think they can run over things. I'm not the one. I am not the one that you can run over, and that's not going to happen. The DILE, no significant statistical difference is apparent in the prevalence for males versus females. In contrast, SLE affects women with considerable higher frequency than men. Female to male ratio 9-1. More whites than blacks develop DILE. More blacks than whites present with SLE. Okay, so that's us with the SLE, and that is systemic lupus, erythematous. Okay, and that is the lupus. Okay, we already researched that. But the female to male ratio is 9-1 when we affect the SLE, and it says more whites than blacks develop DILE. We so mixed up, y'all. We don't know what. My mom was Scottish and Cherokee, so you can't tell me that more whites than blacks. We all mixed up. We're a mixture of ingredients for Christmas and for Hanukkah and for Kwanzaa and for New Year's. Everything you put in your ingredients to cook pies and everything, that's what we are. And that's related to when they say more whites than blacks develop DILE. I got it. So what are we talking about? Prognosis is excellent. Oh, and let me say, they just did my ancestry and found out I was 64% from West Africa. Okay, go figure. And the other percent is Irish. My grandfather was full-blood Irish. So as we look at the prognosis is excellent once the causative medication is discontinued. Now I'm praying that this man knows what he's doing, or I should say out of respect, this doctor. The causative medication is discontinued. Now, the causative one was the plaquenil, okay? I'm writing this down, plaquenil. That was the one that was the causative. Again, you will be getting this because you need to read it and circle like I am, if you have a printer. Death from DILE is extremely rare. That's a good thing to know. And may result from renal involvement, C complications. So it can attack renal kidneys, okay? Renal, okay? That's why it's good to look at what you're eating day to day, research it, see what's good for your kidneys, see how to get things that will help your kidneys. Get things and read on them, the health aspect of it, the different things that you eat. And I'm going to say that that's on you. Whatever you eat should be something that's healthy for your body. Okay. Then it says in diagnosing the condition, okay, in diagnosing the condition, you can have renal failure. Okay, that's what the tests come up. I went in there and they said my kidneys were fine, my kidneys were great, you know. But as we get older, we know what happens. It most of the time it could be good, most of the time, you know, it may do something else. But if you have little ladies living over there in the Ozarks and everything else, and they 115, 120, you know, it's just all what you eat and your exercise and your frame of mind and less stress. That's all it is. You know, for me, that's all it is. You take that stress away. You take situations that get you all wired up. Your body's going to start looking differently because stress can do a lot when you're dealing with lupus and DILE and diverticulitis and was diverticulitis and a lot of other things that uh, go with this. Just a lot of other things. And then as we do, it's extremely crucial to first exclude the possibility that the patient has renal lupus rather than DIL with renal involvement. Okay, so you have to look at that rather than having that situation renal. You got to look at lupus rather than DILE. Okay, so that's a good thing. Now the DILE, I'm not saying I have that, but what I'm saying is the medication they gave me, which was the Plaquenil, may have been the one that that set me off, drug induced, because I don't want to flare off of that. We are in the drug induced causation. Okay, so we got to first figure out what, with our doctors, what medications are you taking that is going to mess with your health, mess with you with this disease. Uh, Ed, I heard you back there coughing. Is there something going on, or do you want me to get off early, or what?
No, no, you're fine.
Okay. So now as we go into inhalers include, oh wow, they got so many things here. You're gonna have to look that up. Inhalers, miscellaneous, hay with fever. You have to look that up because it's gonna give you the explanation of all this. The genetic predisposition may play a role in DILE, has been observed with increased frequency and association with human. I don't want to say all this, and I'm not a scientist with this. So I'd say read it if you want to get to one of those scientists. If you want to send some information to, I think it's Oklahoma, where they have their scientific doctors there, scientists there that have the knowledge on all this, send it to them and see what you can get from them. I think that'd be the best way because I think, you know, that's what I'm going to do, you know. But first of all, we need to do is get our medical reports because I don't have any of mine. And I need to get my, well, yes, I do. Take that back. I have that thing, it's online and I have my number to get in there, my password and everything. So I'm going to get in there and see what's going on. I mean, it's nothing death written or anything. Most of the stuff is good, but I'm just dumbfounded how they, you know, had drug induced and then told me that, oh, you don't have lupus the way they had lupus. What do you mean I don't have it the way they have it? Oh, you're drug induced. And I was so dumbfounded. I'm one that's not less for words. I'm gonna tell you that now. I was stunned. I couldn't say nothing. Couldn't say nothing. But before she left, I said, hold it. Can you sit back down for a minute and explain to me when was it done? How was it? Well, we don't know. We just found out when we did the in-depth study. Well, why didn't anybody else do an in-depth study? What makes you different? You should have, all of them should have been doing in-depth studies. So I would know what I needed, you know, be treated for. So we are I certainly will try to get the answers for you. To like and share so we can get subscribers to subscribe to this channel, and that will bring finances into us to keep on going strong and make this a better channel. It's good now, but it's been in existence for 2 years, but we can learn a lot. But that's why we're breaking it down to more of a news situation here, like a news channel dealing with lupus and trying to break certain things down with our disease and what should we do, and giving you some information on it and letting you know, advising you to talk with your doctor and suggest that you talk with the National Resource Center, and that's the Lupus Foundation of America. Talk with them if they can answer those questions, because they hire scientists all the time because they get grants, and those grants are given to scientists to research. Now, there's something that I had been eyeing, and I was telling Ed about it, our executive producer, and they are talking about something with lupus and um, lupus and finding a cure. I don't know if that's right or what, but I'm going to look it up and send it to him, because I know I saw that. I know I saw lupus and a cure. Don't go say Calvinia at Dr. Williams at Lupus Center Nevada said there's a cure, because I'm trying to find information and you should be trying to find information. I saw that come across my desk. So I'm definitely going to research it and put it on site, give it to Ed so we can figure out what's going on. But they are trying to find cures all the day for every day for lupus. So at least we have some scientists there that are doing things to help us and keep on researching. They're not just sitting twiddling their little thumbs. They are actually researching for the lives of people that have lupus. And we hope that all of us will be able to participate in all of that. Now, there is a participation with clinical drugs all the time. If you're interested in that, I suggest that you contact the Lupus Foundation of America. Better yet, get on their website, because that's what I've been doing. Get on the website. You can get on Lupus website. It doesn't have to be the foundation. It can be a Lupus website. And they have a lot of studies going on that can help you help yourself. Okay. Again, I want to say thank everyone for listening. I appreciate you. I love you. Again, please click and share and subscribe, because it's the only way we can stay functional online. And I'm going to shoot this back over to Ed. And thank you, God, for giving us an opportunity. Amen.
Well,
Ed,
thank you very much, Dr. Williams, for that. It was a great topic, great show, and
thank you.
I'm looking forward for more.
Thank you.
And we got the holiday season coming up. Thanksgiving, of course, is next week, but we'll be on Tuesday before Thanksgiving, so we can give you some good news on that and holiday cheer as
Yeah,
we give
holiday cheer.
thanks for all things that God has given us. So I want to thank you all for tuning in for this edition of Lupus Talks. My name is Ed Peterson, and you're with host Dr. Calvin Williams.
Thank you.
And you go to our website again at lupusinnevada.org. You can donate, you can share, get the information directly from the website. This will be posted on Facebook, YouTube, as well as on the website itself. So you can come back to it and look up and listen to what she had shared if you haven't done it in its entirety. But I want to thank you all for this edition of coming on board with Lupus Talks. Until next week, have a blessed afternoon and keep moving forward.
Thank you.
Mhm.
Bye.
Bye.